Two-thirds of Civil War deaths were not from bullets. They were from disease and infection, and from medicine that could not keep up. Surgeons had almost nothing. No antibiotics, no sterile technique, no germ theory. Number 16 was called the greatest surgical discovery in history. Number 7 was rediscovered in World War II when the replacements ran out. These are 25 field remedies that saved lives when doctors had nothing left. Number 25, maggot therapy for infected wounds. This is the one that makes people stop scrolling. In the weeks after a major battle, when the field hospitals were overwhelmed and infected wounds had been left untreated for days, surgeons noticed something that contradicted everything their training told them. Soldiers whose wounds contained maggot larvae, the larvae of blowflies that had laid eggs in open flesh, were healing better than soldiers whose wounds had been kept clean. The infected, gangrenous tissue was being consumed. The healthy tissue was being left. Confederate surgeon Joseph Jones documented this observation systematically in 1863 and noted that maggot-infested wounds showed dramatically lower rates of gas gangrene. Modern medicine has confirmed the mechanism. Maggot larvae secrete allantoin and proteolytic enzymes that selectively break down necrotic tissue without harming living cells. And their movement physically removes biofilm, the protective matrix that allows bacterial colonies to resist treatment. The FDA approved sterile maggot preparations for wound debridement in 2004. The Civil War surgeons who noticed the maggot phenomenon were observing a clinically valid treatment that medicine formally approved 141 years later. Number 24, chloroform as surgical anesthetic. Before 1846, surgery was performed on fully conscious patients held down by orderlies. The screaming was considered an unavoidable cost of the procedure. When chloroform arrived in Civil War field hospitals, it changed surgery permanently. A cloth soaked in chloroform, held over the nose and mouth, produced unconsciousness within 60 seconds. The patient stopped screaming. The surgeon could work. Between 1861 and 1865, Union medical records documented approximately 80,000 surgical procedures performed under chloroform anesthesia, with a mortality rate from the anesthesia itself of approximately 6 deaths per million administrations. A safety record that compared favorably with surgical anesthesia mortality rates well into the 20th century. The standard dose was 2 to 4 drams of chloroform on a cloth held at a distance from the face, not pressed against it. A distinction that experienced administrators understood and inexperienced ones did not. The difference between an unconscious patient and a dead one was approximately 1 inch. Number 23, morphine for pain management. The Civil War introduced morphine to American medicine at a scale that transformed both its use and its abuse. Morphine, the primary alkaloid of opium, was isolated in 1804 and became commercially available by the 1850s. It was administered to wounded soldiers in quantities that would alarm a modern pain management physician. Surgeons injected it, nurses dissolved it in water, and medical personnel sprinkled the white powder directly onto wounds because patients absorbed it through damaged tissue. By some estimates, the Union Army alone administered over 10 million opium pills and nearly 3 million ounces of opium-based preparations during the war. The pain relief was genuine, and sometimes the difference between a patient who could survive the shock of injury and one who could not. The dependency that followed was so widespread that addiction to morphine became known as the soldier's disease in the years after the war, the first large-scale pharmaceutical addiction crisis in American history. Number 22, ipecac for dysentery. More Civil War soldiers died of dysentery than of any other single cause. In the camps, where sanitation was primitive and contaminated water was shared among thousands of men, intestinal infections spread with terrifying efficiency. The standard pharmaceutical treatment was ipecac, the dried root of Carapacia ipecacuanha, a South American plant whose active compound emetine has direct antimicrobial activity against the intestinal amoeba Entamoeba histolytica, the primary cause of amoebic dysentery. A military surgeon's medical chest in 1862 contained a fixed supply of ipecac as a standard item. When the supply was exhausted, which happened frequently, field surgeons fell back on botanical alternatives that indigenous healers had used for the same conditions. The pharmaceutical treatment of the era turned out to be derived from a plant that South American peoples had known about for centuries before European contact. Number 21. Barberry root for intestinal infection. When ipecac ran out and the dysentery continued, surgeons and regimental physicians who knew their materia medica reached for barberry. Berberis vulgaris, the thorny shrub with bright yellow inner bark that grew across the eastern United States, contains berberine, the same alkaloid found in golden seal and Oregon grapefruit. Berberine has direct antimicrobial activity against the intestinal pathogens most responsible for camp dysentery, including Vibrio cholerae, E. coli, and Shigella. Confederate surgeons operating in regions where pharmaceutical supplies were permanently unreliable used barberry root preparations as standard treatment for intestinal infection. The root was boiled into a strong, dark tea and given in repeated doses. A 2015 meta-analysis of 27 randomized controlled trials found berberine comparable to metformin for blood glucose regulation and documented its confirmed antimicrobial activity. The Confederate field surgeon who boiled barberry root for a dying man with dysentery had the correct active compound in the pot. Number 20. Butternut bark as purgative and anti-diarrheal. Juglans cinerea, the butternut or white walnut, was the laxative of choice for Confederate forces throughout the war, for the simple reason that it grew abundantly across the Confederate states, and the pharmaceutical purgatives that the Union blockade cut off were not available. The inner bark, boiled into a dark liquid, was given for constipation, intestinal parasites, and paradoxically for certain forms of diarrhea, the theory being that clearing the intestinal contents removed the pathogens causing the problem. Confederate surgeon Francis Porcher's Resources of the Southern Fields and Forests, published in 1863 as a guide to botanical substitutes for blockaded pharmaceuticals, recommended butternut bark extensively. The active compound, juglone, also found in black walnut, which appears elsewhere in this channel's history, has confirmed antimicrobial and antiparasitic properties that partially explain the traditional use. Here is the number that puts everything on this list in context. The Civil War was the first large-scale military conflict in which more men survived their wounds than died of them. A narrow margin, but a historic one. The surgeons who achieved this were working with a pharmacopoeia that was partially pharmaceutical, partially botanical, and largely improvised under conditions of extreme supply scarcity. They were also, by the end of the war, beginning to understand germ theory, not from Pasteur's work, which was published in France and reached American military medicine slowly, but from observation. The surgeons who washed instruments between patients had better outcomes than those who did not. The ones who used carbolic acid on wounds saw lower infection rates. They did not know why. They tracked what worked. That is medicine. 19 more. Number 19. Wild indigo for infection and immune support. Baptisia tinctoria, wild or yellow indigo, was one of the most important plants in the Confederate botanical pharmacopoeia. The eclectic physicians who had been prescribing it since the 1830s considered it a powerful antimicrobial and immune stimulant. Confederate surgeons used it for wound infections, for the typhoid fever that swept through camps, and for the septic conditions that followed surgery. The root was prepared as a tincture or decoction and administered both internally and applied directly to infected wounds. Modern phytochemical research has identified polysaccharides in Baptisia with confirmed immunostimulant activity. They activate macrophages and natural killer cells through mechanisms similar to echinacea, to which Baptisia is botanically related. A 1999 study confirmed significant immunological activity in Baptisia preparations. The Confederate surgeon who reached for wild indigo when the pharmaceutical chest was empty was reaching for a plant with real immune-stimulating chemistry. Number 18. Pleurisy root for respiratory illness. Asclepias tuberosa, butterfly weed or pleurisy root, was named for the condition it treated. Pleurisy, inflammation of the lining around the lungs, was a common complication of the respiratory infections that moved through crowded, damp military camps. The bright orange-flowered plant grew across the eastern and central United States and was used by multiple indigenous peoples for respiratory illness before European contact. Eclectic physicians incorporated it as the standard botanical treatment for pleurisy and pneumonia-like conditions. The root was given to promote diaphoresis, the sweating that indicated a fever was breaking, and to relax the chest muscles that tightened painfully around inflamed lungs. Modern research has confirmed diaphoretic and anti-inflammatory properties in Asclepias root preparations. A regimental surgeon who ran out of his pharmaceutical chest and gathered pleurisy root from a field margin was treating the correct condition with a plant that had the correct properties. Number 17. Fringe tree bark for liver and biliary complaints. Chiananthus virginicus, the fringe tree, with its delicate white flower clusters, was the botanical treatment for the jaundice and the liver disease that complicated prolonged illness and malnutrition in Civil War camps. The bark of the root was prepared as a tea and given for biliary obstruction, jaundice, and the liver enlargement that came with chronic infectious illness. The eclectic medical literature of the 1860s considered fringe tree bark among the most reliable hepatic remedies available. Modern phytochemistry has identified saponins and phenolic glycosides in fringe tree bark with confirmed cholagogue effects. They stimulate bile production and flow, which explains the traditional use for jaundice and biliary obstruction. The plant has remained in continuous use in herbal medicine for the same applications for which Civil War surgeons prescribed it, and is currently the subject of renewed pharmaceutical research for liver conditions. Number 16. Chloroform as the greatest surgical discovery. When the American Medical Association surveyed its members in 1848 about the greatest medical advancement of the era, the answer was not a pharmaceutical compound. It was chloroform anesthesia. The president of the American Medical Association called it the greatest surgical discovery in human history. Before 1846, the limiting factor in surgery was not surgical skill. It was the patient's ability to survive the pain of the procedure while conscious. Surgeons trained to work fast. The fastest amputators were the most valued, not the most precise. Chloroform changed the calculus entirely. A surgeon who did not have to fight a screaming, thrashing patient could take the time to work carefully. The outcome data from Civil War hospitals confirmed it. Patients who received anesthesia had significantly better surgical outcomes, not because the anesthesia itself healed anything, but because it allowed the surgery to be done properly. Number 15. Carbolic acid for wound sterilization. Joseph Lister published his findings on antiseptic surgery using carbolic acid in 1867, 2 years after the Civil War ended. But the observations that led to his discovery were being made independently by Civil War surgeons who noticed, without being able to explain it, that wound washing with certain substances reduced infection rates. Carbolic acid, phenol derived from coal tar, was available in American hospitals from the early 1860s as a general disinfectant for facilities. Surgeons who applied it to wounds and instruments were practicing Listerian antisepsis before Lister had published the theory behind it. The mortality rate from surgical infection in hospitals where carbolic acid was used was measurably lower than in hospitals where it was not. The surgeons did not know about germ theory. They knew about outcomes. The outcomes told them something was working. Number 14. Pipsissewa for urinary infection. Chimaphila umbellata, Pipsissewa or prince's pine, was the standard botanical treatment for urinary tract infections in Civil War field medicine. The small evergreen plant with pink flowers that grew in dry woodland soils across the eastern United States was used by Cherokee, Cree, and many other indigenous peoples for exactly the same condition. The painful urination, the frequency, the lower backache that indicated urinary infection. It was incorporated into eclectic medical practice before the Civil War and was in the United States Pharmacopoeia from 1820 to 1916. The plant contains arbutin, a compound that converts to hydroquinone in the urinary tract and has direct antimicrobial activity against the bacteria most commonly responsible for urinary infection. A study in the journal Planta Medica confirmed significant urinary antimicrobial activity. The soldier treated with Pipsissewa tea for a urinary infection was receiving pharmacologically appropriate care with the correct active compound. Here is what the history of Civil War medicine actually shows. The standard historical narrative that Civil War surgery was barbaric, that the surgeons were butchers, that amputation was the answer to everything, is wrong. The amputation rate was high because high-velocity mini-ball injuries shattered bones in ways that made amputation the correct surgical response in many cases, not because surgeons were ignorant. The survival rate from amputation at major Civil War hospitals was 75%. The survival rate from the same procedures performed in the Crimean War 1 decade earlier was 55%. American Civil War surgeons were operating at the edge of their science, and they were better at it than almost anyone in the world at that moment. The botanical medicines they used when pharmaceuticals ran out were not failures of real medicine. They were the real medicine. Number 13. Sumac bark and berries for fever and infection. Rhus glabra, smooth sumac, was the fever medicine of Confederate field surgeons operating in the South, where pharmaceutical supply was unreliable from 1862 onward. The berries, bark, and leaves were all used. The berries, steeped in cold water, produced a highly acidic lemonade-like drink that reduced fever through a mechanism combining hydration, acidification, and the direct antimicrobial activity of gallic and tannic acids. The bark tea was used for wound washing and for the diarrheal conditions that followed from contaminated camp water. Indigenous peoples throughout the eastern United States had used sumac for all these applications for centuries. Confederate surgeon Francis Porcher's 1863 handbook identified sumac as one of the most useful botanical substitutes for blockaded pharmaceuticals and noted its consistent clinical effectiveness. Number 12. Bayberry bark for dysentery and hemorrhage. Myrica cerifera, bayberry or wax myrtle, was the astringent medicine of choice for surgeons and nurses who had exhausted their pharmaceutical supply of styptic and anti-diarrheal agents. The root bark, prepared as a strong tea, had two distinct applications. For dysentery, the high tannin content, bound to inflamed intestinal tissue, reduced fluid secretion and killed pathogenic bacteria through direct antimicrobial activity. For hemorrhage, both surgical bleeding and the mucosal bleeding that accompanied dysentery, the astringent compounds promoted local vasoconstriction and tissue tightening. Confederate medical authorities included bayberry bark in official lists of approved botanical substitutes for pharmaceutical agents. Modern pharmacological research has confirmed bayberry's antimicrobial and astringent properties and identified myricadiol, a triterpene with confirmed anti-inflammatory activity. Number 11. Wormwood for intestinal parasites. Artemisia absinthium, wormwood, was the standard anthelmintic for intestinal parasites in Civil War field medicine. Intestinal worms, including roundworm, hookworm, and tapeworm, were endemic in the populations of both armies, particularly among Southern troops who had grown up in regions where barefoot contact with contaminated soil made parasitic infection nearly universal. The bitter sesquiterpene lactones in wormwood, primarily absinthin and artebsin, are directly toxic to intestinal parasites and have confirmed anti-parasitic activity in modern research. The related compound, artemisinin, derived from sweet wormwood Artemisia annua, became the basis for the most effective malaria treatment in the world. The Nobel Prize in Physiology or Medicine in 2015 was awarded for that discovery. The Civil War surgeon who gave wormwood preparations for intestinal parasites was working with the correct plant family for the correct application. Number 10. Spaghellea for roundworm. Spaghellea marilandica, Indian pink or pink root, was the most specific anthelmintic in the Civil War pharmacopoeia for roundworm in particular. Indigenous peoples of the southeastern United States had used it for intestinal parasites for centuries, and it had been incorporated into formal American medicine early enough to appear in the first United States pharmacopoeia in 1820, where it remained for many decades. The alkaloid spigolline in the root is directly toxic to Ascaris lumbricoides, the roundworm species most common in the American South, at doses that are safe for humans when properly administered. The therapeutic window was narrow. Too much caused cardiac effects, so experienced practitioners administered it carefully. Confederate surgeons who had access to it used it preferentially for roundworm cases because the clinical outcomes were reliable. Number 9. Uva ursi for kidney and urinary complaints. Arctostaphylos uva ursi, bearberry or uva ursi, was the urinary tract medicine that Civil War surgeons who knew their materia medica reached for when kidney and bladder complaints complicated the care of long-term patients. The small evergreen shrub with red berries that grew across cool northern forests was in the United States pharmacopoeia and had been used by northern indigenous peoples for urinary complaints for centuries. The active compound arbutin converts to hydroquinone in alkaline urine and exerts direct antimicrobial activity in the urinary tract. A 1994 randomized placebo-controlled trial confirmed that UVA ursi extract significantly reduced recurrence of urinary tract infections compared to placebo. The plant that Civil War surgeons prescribed for kidney complaints was validated by a randomized trial 130 years after the war ended. Number 8. Culver's root for liver and intestinal complaints. Veronicastrum virginicum, known as Culver's root or black root, was the cathartic and hepatic medicine of 19th century American botanical practice. The dried root, prepared as a tea or tincture, produced reliable catharsis, meaning a bowel movement, and was used for the liver complaints that accompanied chronic illness, malnutrition, and the hepatic effects of mercury-based medications like calomel that Civil War surgeons used in enormous quantities. When the damage from calomel became apparent, with salivation, bone loss, and tissue destruction indicating mercury poisoning, surgeons who recognized what they were looking at turned to Culver's root as a gentler alternative that produced the same cathartic effect through a different mechanism. The plant appears in eclectic medical texts of the era with consistent clinical recommendations for hepatic and intestinal conditions. Number 7. Myapple root, American mandrake, as cathartic. Podophyllum peltatum, the myapple, with its single umbrella-like leaf and waxy white flower, was one of the most powerful botanical medicines in the Civil War pharmacopoeia. The resin from the root is a potent cathartic at small doses, and it is violently toxic at large ones. Civil War surgeons used podophyllin, the resinous extract, as a replacement for calomel when the toxicity of mercury became apparent. It produced reliable bowel evacuation at much lower doses than the quantities causing harm. The active compound, podophyllitoxin, was later isolated and became the basis for etoposide, a chemotherapy agent now on the World Health Organization's list of essential medicines for cancer treatment. The Civil War surgeon who substituted mayapple resin for calomel in his medical chest was using a plant whose active compound would eventually treat cancer. The pharmaceutical that emerged from it is prescribed in oncology clinics today. Number 6. Joe Pye weed for kidney stones and gravel. Utrichium purpureum, Joe Pye weed, named for a 19th century herbal healer, was the kidney medicine of the Civil War era. It was used specifically for the gravel and kidney stones that were common complications of dehydration, dietary inadequacy, and contaminated water that characterized camp life. The tall, purple-flowered plant that grew in moist meadows and woodland edges across the eastern United States was prepared as a tea from the leaves and root and given to soldiers whose kidney complaints indicated the beginning of stone formation. The plant contains euperin and other flavonoids with confirmed diuretic activity that increase urinary flow and reduce the concentration of stone-forming minerals. An alternative name for the plant, gravel root, made its traditional application explicit. The regimental surgeon who prescribed Joe Pye weed tea for a soldier passing kidney gravel was treating the correct condition with a pharmacologically appropriate plant. Number 5. Wild indigo poultice for septic wounds. The same baptisia that surgeons gave internally for infection was also applied topically as a poultice to septic wounds, wounds that had progressed beyond simple infection to the systemic involvement that indicated blood poisoning was beginning. The bruised root was packed against the wound, held in place with a cloth dressing, and changed every several hours. The antimicrobial compounds in the root made direct contact with the infected tissue, and the mucilaginous properties of the preparation kept the wound moist in ways that modern wound care science recognizes as beneficial for healing. Surgeons who combined internal baptisia administration with topical application were treating infection from two directions simultaneously, offering systemic immune support and local antimicrobial action, a combination approach that modern infectious disease medicine employs with pharmaceutical agents. Number 4. Pine pitch for wound sealing. When dressings ran out and wounds needed to be sealed against further contamination during transport, field surgeons reached for pine pitch, the thick, resinous sap from pine trees that hardened on contact with air. Applied warm and allowed to cool, it created a waterproof barrier over wound surfaces that prevented the contamination that came from field conditions. Pine resin contains turpentine compounds with confirmed broad-spectrum antimicrobial activity, the same chemistry that Confederate surgeons used as internal medication for respiratory infection, here applied externally as a wound sealant. Indigenous peoples throughout the forested regions of North America had used pine pitch for wound sealing for centuries before European contact. The field surgeon who raided a pine tree when his dressing supplies were exhausted was applying a material with real antimicrobial properties that also happened to be available in infinite supply wherever pine trees grew. Number 3. Spruce tea for scurvy prevention. The same problem that killed sailors on long ocean voyages killed soldiers in winter camps: vitamin C deficiency. By January of their second or third winter in the field, soldiers whose diet consisted primarily of hardtack, salt pork, and coffee were beginning to show signs of scurvy. Gums bled, old wounds reopened, joints ached. The cure was available in every forest. Spruce needles, from Picea rubens or any other spruce species, steeped in hot water, produced a tea with more vitamin C per cup than orange juice. Native American peoples throughout the northeastern woodlands had known this for centuries, and it had been recorded by European explorers as early as Jacques Cartier's 1535 account of being saved from scurvy by indigenous tea made from what is believed to have been eastern white cedar or spruce. Union surgeons who ordered spruce needle tea for winter camps were following a protocol with 400 years of documented evidence behind it. Number 2. Morphine paper, the first transdermal drug delivery system. One of the least known innovations of Civil War medicine was the morphine paper, a paper square impregnated with a measured dose of morphine sulfate that could be applied to a wound and allowed to absorb through damaged tissue. This was not improvisation. It was a manufactured pharmaceutical product supplied to Union field hospitals as a way to deliver analgesia to soldiers who could not swallow, and in situations where injection was impractical. The morphine paper was the first commercial transdermal drug delivery system in American medicine. The direct conceptual ancestor of the nicotine patch, the fentanyl patch, and the dozens of transdermal pharmaceutical preparations prescribed today. The innovation that is now the standard delivery mechanism for dozens of controlled substances was developed in Union field hospitals under pressure of wartime supply constraints. Number 1, the discovery that changed surgery forever: hand washing. The single most important medical advance to emerge from the Civil War was not a drug, not a plant, and not a surgical technique. It was the observation independently made, imperfectly understood, and inconsistently applied, that surgeons who washed their hands and instruments between patients had dramatically better patient outcomes than those who did not. Ignaz Semmelweis had published this finding in Vienna in 1847 and been institutionalized for his insistence on it. Lister published his antiseptic surgery findings in 1867. But in Civil War field hospitals, from 1862 onward, individual surgeons who observed outcome differences and responded to the data by changing their practice were making the same discovery through empirical observation. The American surgeon who washed his scalpel between amputations in a field hospital tent in Virginia in 1863 did not know about germ theory. He knew that his patients were surviving at a rate that the surgeons in the next tent were not. That observation, that difference, is where modern medicine begins. 25 remedies. From 4 years of the most medically demanding conditions in American history. The surgeons who worked under those conditions were not barbaric. They were operating at the absolute edge of what medicine knew, under logistical constraints that modern physicians cannot imagine. And they were doing it with a combination of pharmaceutical agents, botanical medicines, and improvised materials that kept more soldiers alive than any previous war in human history. The botanical medicines on this list were not failures of real medicine. They were real medicine. The medicine of people who knew their plants, who tracked their outcomes, and who used what worked when nothing else was available. Subscribe to Forgotten American Ways, because this knowledge is still here, and it still works.